My name is Stokes Peebles, and I am the Section Chief for Allergy and Immunology at Vanderbilt University Medical Center. I'm also a professor of medicine in the Division of Allergy, Pulmonary, and Critical Care Medicine. I think one of our strengths at Vanderbilt is our diversity. So a fellow has a broad range of experience both in the research realm, but also in the clinical realm as well.
Allergy is an incredible practice and an incredible subspecialty. My focus is in primary immunodeficiency. So here in Tennessee, I help head the newborn screening for SCID and also work in a combined clinic for patients with immunodeficiency. We have very busy adult and pediatrics clinics. Fellows can spend time in our occupational asthma clinic or occupational lung disease clinic. They can spend time with rheumatology, dermatology, ENT, and then in our specialized drug allergy, immunodeficiency, and EOE clinics. Our fellows really get to see the true scope of the practice of allergy.
So my research focus is on clinical trials in asthma and allergic disorders. My focus is on clinical asthma, severe asthma, asthma in the young child. Our fellows have the opportunity to participate in these clinical trials and learn how these trials are done, because I think this is a really critical aspect in translating what we learn in the lab, what we learn about patients, and really understanding the manifestations of disease and the scientific approach.
The allergy and immunology program is essential. Allergies are growing worldwide. Vanderbilt, I think, ranks high nationally in many areas. Our allergy and immunology fellows do a tremendous job. We need young people who are smart, who can take on challenges and think new ways of dealing with these problems.
We are a part of the Vanderbilt Lung Institute, so our fellows have a unique opportunity to learn deeply about various allergic and immunologic airway and lung conditions. We offer extraordinary research in basic sciences and clinical areas.
The fellows here at Vanderbilt are an integral part of our team. There is no shortage of patients here. We see a lot of people all day long, every day. I look particularly at two conditions, food allergies and allergic skin diseases. So I have a high level of interest in those two things and see a lot of patients in those departments. I think what I can do for fellows is broaden their ability to think a little bit outside the box.
My name is Basil Kawash. I'm an assistant professor of medicine and I work in the Vanderbilt Asthma, Sinus, and Allergy program. I'm the director of quality improvement within the fellowship program. All of our fellows get dedicated quality improvement training. So in addition to pursuing scientific discovery on the research side, all of our fellows get experience in applying everything that's been learned from the scientific process and from clinical research, bringing that into clinical practice, and they all get a chance to design a project where they think about, okay, we know what works, now how do we make sure that we're doing it in the best way possible for our patients?
The overall experience at Vanderbilt, I think, is unique in the breadth and also the depth of the program. We see a lot of what we call tertiary care patients, patients referred by regional allergists for diseases such as mastocytosis, idiopathic anaphylaxis. I also have a focus in seeing adult patients with immunodeficiency and mast cell spectrum disorders as well.
My name is Iglesia, and I'm an instructor in medicine and pediatrics. So I'm fortunate to be appointed in both in medicine and pediatrics, and we'll be having clinics in the adult clinic as well as a pediatric clinic. So I think it's a really exciting time to be studying allergy and food allergy in particular, in terms of discovering therapies and different ways we can help families from having life-threatening reactions to their food allergies.
So I'm Rick Chandra. I'm the director of the Division of Rhinology in the Otolaryngology department here at Vanderbilt. So I work with the fellows directly, teaching the ENT side of the nasal and sinus disorders that collaborate with the group in allergy and immunology. We're a very collaborative environment. Our allergists are more than allergists. They're really immunologists.
Vanderbilt is at the center, really, of precision medicine research in the United States. I direct drug allergy services, both clinical and research. We started a clinic that specializes in drug allergy services And I feel this has really, transformed care. In addition to the clinical experience in the drug allergy clinic, all of the fellows have the opportunity to do research.
We see a lot of patients with drug allergy here in children. In fact, we're, quite a referral source for that. I started a program here in 2015 where we have specialized skin prick testing for children, and then I've helped to kind of guide our clinic into processes to make that very doable and easy for our patients, and establish protocols that have helped really increase our number of patients that we see.
Some of the really unique services that we offer include our drug allergy service, which I'm a part of, and we have a catchment area that's about 6 million people. We have more than 200 patients with humoral immunodeficiency. We have 10 to 20 patients with hereditary and acquired angioedema. We have patients with alpha-gal. We have patients with all of the rare conditions that you may not get as much exposure to everywhere.
I study mostly patients with severe asthma, looking at ways that the immune system drives disease with the goal of developing novel therapies to treat these patients. In my clinics, fellows really learn to evaluate as well as get comfortable with the use of biologic therapy and learn how to do aspirin desensitizations.
I think the allergy fellows have an absolutely incredible experience here, both on the clinical side and research side. The breadth of both the clinical experience as well as the opportunities in research across a really number of broad areas of research are truly phenomenal.
The uniqueness of Vanderbilt's Allergy Fellowship is the ability to tailor your research experience and your fellowship experience to your interests. I'm a basic science researcher that focuses on mechanisms of lung inflammation, particularly why women are more likely to get asthma as adults compared to men. So how do sex hormones regulate airway inflammation in asthma?
I do research in allergic diseases. I think what's important is for allergy fellows to understand where the knowledge that is at the center of their disease process originates, and ask questions of that basic science that may then ultimately lead to things that can improve the diagnostics and therapeutics used in the allergy field.
I wanted a program that would show me a broad breadth of everything my first year so I could really find my own niche my second year and figure out what I enjoyed doing.
Vanderbilt has given me an opportunity to work with really smart people and have a wide array of choices to choose from, whether it be really lab work, clinical work, working with a bunch of different diseases that you don't see in other places, things I've never heard about before I came here, and having some of the world experts in that's been giving me opportunity to delve further into that.
When you graduate from our program, the goal is that you will be able to make a difference no matter who walks in the door.
We're lucky here at Vanderbilt to have such world-renowned physicians, scientists, and physician scientists. It's a really stimulating and collaborative environment to work in.
When our fellows finish the program, they can offer a lot because they've had experience in basic immunology and taking care of people who have immunologic diseases. They have also seen a lot of the bread and butter allergy and also severe asthma. I think one of the great benefits of coming to Vanderbilt is Nashville. Nashville is a great place to live. The people are incredibly friendly. We have a lot of great cultural opportunities. We have major league sports. So there's a ton of things to do here in Nashville, and it's just a wonderful place to live.